William, hopefully your favorite videographer from Two Hats Publishing. I welcome you to another Two Hats special of community events. Let's look in and see what's really happening.
Good afternoon and welcome to the latest edition of Lambda Weekly. I'm Lerone Landis. David Taffet is on a much needed vacation. Actually, I think he's at the LGBT Journalists Association conference down in Florida, so he's going to also mix it in with a little vacation. And Patty's on vacation also, Patti Fink. But filling in, we're happy to have Leslie McMurry and Katie Sprinkle to help us talk about some issues that happened this week. Thank you, ladies. Welcome.
Thank you. Also, happy birthday to Patty. Today's her birthday.
That's right. Today is her birthday.
Happy birthday.
Happy birthday, Patty.
And I bet you she'll be late to her own birthday party.
I wouldn't doubt it. Well, let's just talk about lots has gone on this week. I guess the biggest news item is the failure of the big swapping failure of Trump Care, which is actually the American Care Act. What are they calling it?
It's called Hate Care.
Hate Care. Yeah.
There we go.
Let's call it what it is.
Make America sick again.
So, were you all surprised about this?
No. The lead up to it, I mean, you know, the Republicans have spent 7 years repeal and replace. What we found out was that what the Republican Party is really all about is catchy slogans. They didn't bother to spend the last 6 years doing anything other than
opposing what was already there.
What was there and trumpeting the repeal and replace. They had no plan. They threw something together. And
I like Trump's quote as saying, wow, healthcare is a whole lot more complicated than you'd think.
Yeah,
it is, isn't it?
No crap.
And so, you know, when you spend 7 years doing nothing but complaining and don't actually think about what you need to do, it's not surprising. It also demonstrated something we were talking about off air, the divide within the Republican Party, because you've got that ultra-conservative wing, which ultimately is what trashed this effort, which I'm fine with, but, you know.
Right. We're going to have health care. It's going to be tremendous. Everybody's going to have it. We're all going to be covered. It's going to be the best ever, the best health care. It's going to be fantastic.
Then she did the best impression. No, you're absolutely right, Katie, because, again, for the past 7 years, that's all they've been talking about is repeal and replace. They haven't really talked anything about, you know, what are they crafting. And first of all, let's make it, I think, even though I like the Affordable Care Act, it's not perfect. So everyone has always said, you know, look, we're open to making it better, amending it. But there are some good things in it. There's some great things in it. And with this, it seemed like it was just a rush job. It was a rush job. And so the Republicans have been going on again for 7 years about it. They want to get rid of the thing. It was so bad. It was so evil. You know, it's going to kill the country. So when even they didn't vote for this Trump Care bill, that means it must have been way worse than the Affordable Care Act.
Well, actually, they wanted it to be worse still. There's that Freedom Coalition, Freedom Caucus, whatever. Mm-hmm. They wanted it to be a lot worse. They wanted it to cover fewer people, cover fewer things, have lower reimbursements, and be a much worse health plan. The moderates wanted it to be a little bit more like the Affordable Care Act, and of course the Democrats liked it as it is. So you had these three different factions, none of which could agree. It's funny that Trump would blame the Democrats when he had enough votes in the Republican Party to pass it without a single Democratic vote.
He did.
Blame the Democrats is just saying, I don't understand the system. And there's so much wrong with health care. I deal with it every single day. I deal with HIV patients every single day. And they're scared to death of changes that are going to maybe deny them access to medication that's keeping them alive. So
yeah, I was going to say, could you talk a little bit about why was this so? Not it's important to everybody, but particularly to the LGBT community. Why the Affordable Care Act was better than what they were proposing?
Well, because prior to the ACA, if you had HIV and you lost your insurance, you could never get insurance again because it's a pre-existing condition that you're going to have for the rest of your life, and no one's going to insure you. And so that's pretty terrifying because that throws you into the public health system. Fortunately, through Ryan White funding and things like that, generally we can get you medication. But if that's taken away, I don't really know what's going to happen. All I know is it's a whole lot cheaper, even as expensive as medications are. It's cheaper to keep someone healthy than it is to treat them in a hospital setting. So I think, if you're going to be far-sighted, the manufacturers are willing to kick in, insurance companies are willing to kick in, and so the medication can be provided, keep people healthy, and turn it into a chronic illness rather than a fatal disease. But beyond that, there's so much else that needs to be dealt with. I mean, there's one thing that they're not talking about. There is a physician who I know that recently retired, and she said that where she went to school to get her medical degree is $55,000 a year now to go to medical school. And that's not terribly uncommon. So you're talking about somebody coming out of medical school with over $200,000 in student loan debt.
Right.
Well, she pointed out that her partner got more in 1970 for a joint replacement surgery job. There was a higher reimbursement for that than there is today. So if it was, a couple, $3,000-$4,000 per year back in 1970 for medical school, and you're getting more money. Now it's 10 times as expensive, yet you're getting less money. Fewer people are going to want to take that student loan debt on if they're not going to make the money for it.
Right.
So there's a whole lot that really needs to be addressed at the front end, at the back end, at the patient end, at the hospital end, at the government end. Like Trump said, who knew it was so complex?
Well, and the other thing you've got to look at and you've got to remember is that Republicans didn't want to change from the old system, which the Affordable Care Act replaced.
Totally did.
Which was basically you got your insurance through your employers. If you were self-employed or unemployed, you could go and buy insurance, but if you had a pre-existing condition...
Like being transgender?
Yeah. You would go into the quote-unquote high-risk pool, which is something that Paul Ryan was touting, high-risk pools are the way to go, except that high-risk pools were never properly funded. So if you were someone with pre-existing condition, had to go into a high-risk pool, the insurance premiums were outrageously expensive. And if you didn't have access to some subsidy funding from some private source, you were just out of luck.
Yeah.
So, first of all, you've got all these Republicans who didn't want to change from that system to the Affordable Care System. Then when the Affordable Care System came in, let's not forget that for 6 years we've known that there were problems and that they should be addressed. And the Republicans refused to even talk about it. And so then what they did was they came up with a catchy slogan, repeal and replace. The problem with repeal and replace is no matter what system you put in, since you're quote-unquote starting from scratch, it's going to have problems.
Yeah.
So since you've got a framework in place, any rational, logical, problem-solving human being would say, okay, look, let's find out what the problems are. Let's address them individually.
Yeah, it should, instead of repeal and replace, it should be tweak and examine.
Yeah.
Tweak and examine.
Yeah.
So,
tweak and examine.
The biggest problem the Republicans claim that they had with the Affordable Care Act is that it was the mandate that you had to have insurance, that you had to get insurance some way.
Well, that keeps healthy people in the insurance pool, which brings policy premiums down for everyone. If you take healthy people out, and they're willing to say, well, I'm going to go and pay cash for my health care. I don't need insurance right now because it's fairly expensive. That drives it up extraordinarily high for everyone else. And the other thing that right now under Obamacare or the Affordable Care Act is the subsidies are based on your income. So people that make less money get a higher subsidy because they can't really afford it. It makes it affordable. Under Trump's plan, under the Republican plan, it was going to be based on age. So somebody who's, say, 58 years old in the prime of their earning capacity, who's making $200,000 a year, is going to get a higher subsidy than someone who's 21 years old, has a bunch of student loan debt, and is working at Wendy's.
Yeah.
Well,
how is that fair?
Yeah. My problem with I'm not 100% behind Affordable Care. My problem with it was we're subsidizing their insurance. We should have had a government option.
I actually agree with that.
I don't think we should take my tax dollars, your tax dollars, and give them to for-profit companies for health insurance. If we're going to do that, then we should just fold all those people into Medicaid and take care of it that way.
That's what they're going to do under block grants.
And the block grants don't work because Congress won't fund them properly.
No, and those are the first things to get cut when there's a budget issue.
Yeah, and my thing is, take the states out of it. Stop giving the states money to provide health care.
But they've also shown through all this that the states who are actually using the Affordable Care Act the way it was intended to, Texas is not one of them.
Correct.
It's actually working.
It's working very well.
Very well.
States that
have the Medicaid expansion.
Exactly. Texas is not one of them. And Texas has the highest amount of uninsured people in the country.
And the number of states, look at Kentucky. They had a governor who ran on a platform of taking Kentucky out of the Affordable Care Act. Tons of people voted for him. And then tons of people lost their health care, and they were like, why'd you take my health insurance away?
Exactly.
And he was like, well, I told you I was going to, yet they voted for him anyway.
Exactly. Well, these are the same people who think that Obamacare and the Affordable Care Act are two different things.
Yeah.
It's like, really, no, honey, it's the same thing.
Which do you think is better?
Yeah, exactly. Well, to quote our Speaker of the House, Ryan.
Yeah,
Paul
Ryan. Now, Obamacare is the law of the land for the foreseeable future.
And the magic to that is you can point to the Democrats all day long, but when you control the House, you control the Senate, and you control the White House, then it's your plan. Whatever exists is your plan.
Is your plan.
Yeah, and what Trump said the other day, we're just going to let it explode. And it's like, well, guess what, jackass? It's going to explode on your watch. And you and your Republican friends are going to get blamed for it.
Yeah, you had an opportunity to do something about it, and you couldn't get it done.
There are some, that has been one of his arguments, just let it implode on itself. But there's a lot of, medical forecasters who, this is their job to watch it kind of thing, saying that they really don't see any evidence of that.
Yeah.
So,
well, they don't see any evidence of it now, but you take away the mandate, healthy people start dropping out. They start cutting funding, start cutting the subsidies. They can create a situation where it's going to happen.
They can.
Where I'm
and I think they will.
It's going to implode is from the people that we're helping at work. I deal with insurance all day, every day. And last year, under the ACA, our average policy premium was around $268 maybe. This year, it's about $450. So it's gone up dramatically this year. Where the expense is falling is more on the federal government because the subsidy is higher because people are low income, so the government is paying a bigger chunk of that $450, so it's not being felt as much by the individual. So if the government ends up cutting some funding to that and the subsidies aren't cut as much, people are going to find that they're paying, $600-700 a month for insurance, which is going to get unaffordable.
What's going to happen in Texas is those premiums are going to continue to go up.
But don't they always go up, though?
Yeah, not this much.
But not this much.
Yeah, because, I'm cynical. I don't trust health insurance companies. My biggest problem with the Affordable Care Act is it gave the greedy ones way too much power, because now look at what we're seeing in Texas. United Healthcare, who I was with last year, isn't even in the healthcare market this year, and probably won't be.
Aetna bailed, United Healthcare bailed, I think Cigna's out of the individual, and Scott and White bailed in Texas.
So now you've got Blue Cross Blue Shield, and then you've got some smaller ones that have jumped in. But a lot of doctors are now starting to not take those smaller plans because they can't get paid.
Yeah, I had a client who needed a colonoscopy, and for it to be in network, the closest place he could go in Dallas is Houston.
Get out of here.
Yeah.
Stop the madness. Are you serious?
Yeah. Houston.
I'm self-employed. So I get my health insurance through the State Bar, which is a private health care exchange. And of course, I'm now victim of all these insurance companies pulling out. So I was down to basically Blue Cross Blue Shield or Molina Healthcare. And we actually know the CEO of Molina Healthcare. The only hospital in the area that I could have gone to, and I live in the Coppell-Carrollton area, I would have had to have come over here to Methodist. That's the closest hospital, and none of the doctors that I have seen for the last 15 years were covered. So I could have gone to like a couple of urgent care clinics. They were covered, but that was about it.
Wow.
So you just don't have a lot of doctors in some of those smaller plans, and even some of the bigger plans, the doctors are bailing on some of those.
Well, again, Paul Ryan said that, the Affordable Care Act is the law of the land now for the foreseeable future. I don't know what the foreseeable future means for the next month. But, we're about to wrap up, but about to go to break. But just real quick, do you all think that they're going to try again within the next year or so?
2017 is pretty much set. It's a little late.
It's a little late.
Open enrollment kicks, if they keep it under the current program, will start in November. I'd like to see them get rid of open enrollment, because if you're mandating that people have insurance, saying, you can't get it between the end of January and the beginning of November is a little bit ridiculous. But open enrollment starts in November for 2018, so I don't really see any changes until probably after the midterm elections. That's just my guess.
And the midterms are going to control that. They're not going to do anything with the ruckus that they saw this past year.
Right. So. All right, we need to take a break. We'll be right back with more of Lambda Weekly with Katie Sprinkle and Leslie McMurry.
Hi, this is Patti Fink, and you're listening to Lambda Weekly on 89.3 KNON FM.
Welcome back to the Lambda Weekly. I'm Lerone Landis, here with Katie Sprinkle and Leslie McMurry today. Thank you so much for filling in for Patty and David, who are kind of on vacation this week. Just before the break, we were talking about the failure of the new proposed Medicare law, medical bill, to repeal and replace the Affordable Care Act.
Or the failure of just Congress and the Republican
just failure in general. But now I want to move on to digress a little to another subject, but still in the same area of medical care. And that is, there's a transgender woman who's been in North Carolina. She's been arrested for practicing surgery without a medical license. Apparently, she injected another trans woman who was 19 years old with butt injections, silicone butt injections, and the 19-year-old passed away. And unfortunately, this isn't a story that we have not heard before. See here, according to the New York Times, too often performed outside of a licensed medical facility by a non-licensed medical professional. This illegal procedure is the work of what the community calls as pumpers. I had never even heard the term pumpers before, but I definitely knew that it used to happen. And so the woman who performed, the transgender woman who performed the procedure, she has been arrested and charged with second-degree murder.
And practicing medicine without a license.
Exactly. That. So I kind of wanted to get you all's take on it. One, maybe you, Katie, do you think that's a harsh charge, second-degree murder, as an attorney?
Yeah, I think when you go murder in that scenario,
implies intent.
You're going over.
That's what I was thinking. I was like, at least manslaughter.
You typically will see manslaughter or what we refer to as felony murder. If you are engaging in a felony offense and someone dies, and the offense involves the something that's inherently dangerous to human life, you can then be charged with felony murder. Now, this is different from capital murder, where I'm committing the felony of aggravated robbery, which I'm robbing you, and then I intentionally kill you. Felony murder would be more of the situation that Lerone and I go in to rob a bank, and the bank security guard kills Lerone because I was engaging in an act clearly dangerous to human life, an aggravated robbery, and someone died, not through my actions necessarily. I could be charged in a felony murder. So since you're illegally injecting someone, you're looking at the possibility of felony murder, manslaughter, and typically manslaughter, criminally negligent homicide would be the area when you start to go murder.
Yeah.
Really raise the bar, and I don't see. I think they're overplaying their hand a little bit.
Yeah, and perhaps
it's still
once,
tragic. Yeah.
It is, absolutely. No one's wants to cheapen the death of this woman. A death is a death, but legally, still she didn't set out to kill this woman. And then the other side of this issue is, I guess, just body enhancement surgeries, and which some trans individuals do, some don't. But when they do it, unfortunately, a lot of them, I wish we had a camera right now. But when they do it, unfortunately, a lot of ladies in our community go underground and have it done by, again, that term called pumpers.
Well, and just so that you know, there's a trial that's been going on here in Dallas this past week involving a woman who was not trans, who was having these injections done, and she died. And the person who is injecting her, allegedly, is the one that's on trial. So,
do you know what her charge is? Is it murder?
No, they did I think it was a manslaughter.
Manslaughter. That sounds more appropriate.
Probably the appropriate charge.
Yeah.
So, there are a lot of people within the trans community that do it. There are a lot of people that are not in the trans community
absolutely
that do it. It's known as pumping, and it's not done by, in fact, it's not FDA approved. Just quick history lesson. There was a time when you could go to a plastic surgeon and they could inject silicone instead of doing the implants, which are now contained in sacs, and the silicone is within the sac. The injections were very popular in the 60s and 70s, and then in the United States, we banned them. And so that procedure then went underground. And so now you have a lot of people who are using not surgical grade silicone. I mean, they're literally going to Home Depot, buying silicone, mixing it to thin it out, and then injecting it into people's bodies.
And we're, just so we're clear here, if you've never heard of what we're talking about, this is done literally at somebody's house or in a hotel.
Yes.
As reckless as it sounds, before the show, Leslie, talk a little bit about why even some of our trans sisters, even though they know it's dangerous, they've been told it's dangerous, they do it anyway.
Well, I think part of it is a desperate desire to feel more feminine. And that's kind of married with a lack of funds to do it through the medical community, because breast enhancement can be $6,000-$7,000, and when you start adding up different places, whether it's in your face or your butt or your legs or your wherever, it can start to run into some serious money. And if you've got somebody that'll do it illegally at a pumping party for $500, that sounds pretty attractive.
Right.
And like Katie said, some of the women swear by it until maybe there's complications somewhere down the road, or that silicone migrates somewhere it ought not, or there's an infection or an allergic reaction or any of those kind of horrible things that can be done by people that don't have the education and the technique and the ability and access to things that are medical grade. It's a recipe for disaster, and I feel really bad for those that have had bad results, but I can understand from an empathy standpoint of why they might, And while I wouldn't go that route, I can see, someone who says, if I spend $500, at least I have a chance.
Right.
And I have known, I first heard about pumping in the late 90s. I actually got invited to a pumping party. And I was like, hey,
what is the pumping party?
So a pumping party is sort of like, remember the old Avon parties?
Yeah.
That's sort of what it's formed after. Basically, you get the pumper, whoever is going to do the injections, and you get them a location. Because back in those days, people traveled. The pumpers were typically almost like traveling salesmen with the big suitcases, and then they would stop, go to Home Depot or wherever and get the quote-unquote supplies. And then somebody who was hosting the party would get either at their house or in a hotel room that had a kitchenette. And literally what you would do is you would invite several people. And the more people you got, the better it was for everybody, because it was less money for each individual. And you would come in and you would pay money and then go into one of the bedrooms and get whatever you were going to get injected. Girls have done their lips, they've done their cheeks, they've done their breasts, they've done their tushes.
Right.
And it's just a party.
Wow.
And you may have 6, 7 girls there. You may have one pumper, and then the person who's hosting the party. And that's sort of how it used to work. Now it's changed. Now you see some who will have their own salon. They'll have maybe a legitimate business. Like the case here in Dallas, there was a legitimate business. They did makeup and some of those types of things.
The business is legitimate, but what they're doing is not.
Right. And then sort of on the side,
right,
with their legitimate business, they were also doing the illegal pumping.
Yeah.
So that's what a pumping party was. You would get together with a bunch of girls who wanted to get pumped. You would bring in the pumper, and everybody would sort of pay for whatever it was they were having done. Now the dangers, obviously, there are many. Infection, because they're not using, in all cases, medical grade silicone.
Or sterilized stuff.
Yeah.
It's Home Depot.
It's Home Depot. Sometimes, I mean, literally. There was another case I heard about a couple of years ago, in a woman who literally had her butt filled with cement. Literally cement. And after a while, your body is not going to keep it. It's going to reject it. And the woman's, a good portion of her butt fell off.
See, she should have used steel, so she got buns of steel rather than...
As you go, buns of steel.
Concrete.
So, but, in all seriousness,
once you inject that stuff, getting it out is next to impossible.
Right.
And, like geese, it migrates.
Yeah, it travels.
And you may start with it in your tush. It may end up floating freely throughout your entire body. And the woman who died here in Dallas had some that got into a blood vessel, went through her heart into her lungs and killed her. That's a common side effect, that if you inject it under enough pressure, it will get into blood vessels.
Well, part of the campaign for the past couple of years was the campaign, things get better, basically, just wait. Just wait. I like to say that to some of our young trans sisters who want to get, again, everybody doesn't want to do it, but for the ones who want to body enhance, just wait. Just wait, save your money, get some good credit, get a good credit card or something, and go have it done by a medical professional.
Yeah, I mean, things are changing on the health insurance side. More and more companies are adding the transgender health benefits so that more transition-related care is being paid. It's still in its infancy.
But they're starting to understand that it's medically necessary in the areas where it is considered medically necessary by a doctor,
right,
and it's covered by the WPATH standards of care. It should be taken care of.
And in fact, the city of Dallas just recently, for city employees, included transgender health care in their health care policy.
Yeah, which was wonderful news. Yeah, you told us about that last week. That was wonderful news.
So,
and thanks to Patti Fink for her steadfast advocacy in that area.
Yeah.
So it is looking up. It is, I get it. It's slow, and it's something that we need to focus on moving forward. But going the pumping route, it's extremely dangerous.
Extremely.
if it doesn't kill you right now, it may definitely shorten your life extensively. Because, again, that material, your body, it's there, and it's causing problems.
You don't need that junk in your trunk.
You really don't. Not that kind of junk.
Not.
So, all right, we're going to take... we're going to do an entertainment report. I haven't done this in probably a year or so. So, here we go. Hold on. There we are. All right, let's all send out a big congratulations to RuPaul, the Emmy Award winner just announced last week that he and his partner of 23 years tied the knot and married back in January, but didn't tell anybody. RuPaul jokingly said that they married for tax breaks and financial purposes. There's nothing wrong with that, if that's the only reason why you got married. But then added that in light of what's happening in the world and in Washington, they did it because there's too much at stake. Absolutely. I say that to all, my LGBT friends, look, you have the legal right to do it now. Don't get upset when something happens.
Why are you looking at me?
Okay, I'm going to look at Josh. Don't get upset. Well, Josh has a fiance first.
Put him up to that.
That check is not going to clear, Lerone.
Dang, well, no, she's giving me cash. But no, seriously, we have the right now. If something goes wrong and you're having a fight and they're saying, no, you can't do it, XYZ, there's so many things, XYZ, because you're not legally married to this person, well, look, hey, you knew you could do it. So, but congratulations to him. It's been 2 years now since the groundbreaking ABC special of Diane Sawyer interviewing the then Bruce Jenner. Now, Caitlyn Jenner will once again sit down with Diane to discuss the reality of what her life has been like since the interview. Caitlyn also has a new memoir, which I didn't know about, coming out called The Secrets of My Life. It's going to be released on April 25th.
Which is also the secret for why she's doing an interview now.
Of course. So, what do you all think about Caitlyn Jenner?
I wonder how many 64-year-old women are named Caitlyn.
Well, there's Caitlyns around, so if they're lucky...
but they were all born in, 1995.
True.
Yeah.
It's like Brittany, It's like if there's a 64-year-old woman named Brittany. No, not so much.
I'm not a huge fan. She had an opportunity to really step up and
be a voice
for change, for positive change.
Right.
And before she transitioned, she would later say she didn't know any transgender people.
I know.
And it's like, okay, I get that you were famous, and I get that the level of closet that you had to be in was tremendous. I get that. But for 20 years, I was in the closet, and yet I was out and about within the transgender community. That's how I know all the people that I know. And I understand, even though I did not endure some of the things my sisters endured, I saw it, and I was involved in it. And so when I transitioned and came out, I became more of an activist because I saw what they had gone through, and I knew what I feared I was going to go through. And because of her privilege, she didn't do any of those things.
No.
Only worse. She advocated things that would hurt us.
Yeah.
Right. Yeah. Well, I thought the interview, the special, the ABC interview 2 years ago, I thought Diane Sawyer did an amazing job just on the topic alone. And I tried to give Caitlyn the benefit of the doubt because it was clear that she did not know, not clued in what it's like for your average transgender person.
But that's clear when she declared herself a Republican.
Exactly.
And was trying to Ted Cruz elected. And,
right.
For people that want to see us erased from the social landscape, that's kind of like saying, well, erase everyone but me because I have a tremendous amount of money. I've got walls around my Malibu estate, and I can afford to have bodyguards, and I don't have to worry about getting beaten up or arrested in a bathroom, and on and on and on, the privilege that she has. And for her to not even just remain silent, but to advocate for somebody who wanted to see us erased, I'm always going to have a big problem with that.
Yeah.
I just, my concern also was, I understand that celebrities oftentimes are the people we look to because they've got the platform, but they're not necessarily the best role models. I love...
Oh, that's absolutely... I think that's true across the board.
I mean, I love Laverne Cox, but she's got to be careful about what she does, because if she crosses a line, her entertainment career is over. I think of Jodie Foster, for years was in the closet because, again, she was fearful of the damage that would do to her career. And
it's sad you have to make a choice there.
You shouldn't have to, but the reality is they do. And, I love Laverne, but, she's got to be careful. That may not necessarily be the best role model, but she's the best one we got.
Yep.
She's a great one, don't get me wrong.
She is.
I'm a big fan of hers, not so much Caitlyn Jenner.
Hopefully there's more to come, more visibility. After a postponed opening, Malaysia has cleared the release of the new live-action film Beauty and the Beast, following controversy of the inclusion of a gay character. On Thursday, the Muslim-majority country's censor board, the LPF, had demanded the brief 3-second moment. Now, I still haven't seen this movie, but everyone who has seen it told me it literally it's a blink of an eye.
You blink, you miss.
Yeah, you blink, you miss. And Malaysia postponed showing the film, saying that they wanted it edited before they would show it. Disney, kudos to them, said, we're not going to edit it. Either show it as it is or don't show it at all. So they came around and they showed it. So good for them. And, again, good kudos to Disney for sticking to their guns. Now, just a reminder, in the first week of its release, it was a theater in Alabama who pulled the movie all together.
Well,
not a surprise. It's Alabama.
I grew up once in Alabama. They're getting us back.
Yeah.
I've got photographic proof.
All right. And last, Academy Award winner Julie Andrews has a new Netflix children's show called Julie's Green Room that just may be the most diverse children's show anywhere on TV. It features Jim Henson puppets that include a child in a wheelchair, child from all different ethnicities, and a child that is gender neutral. We don't know. And that's mine. That's mine.
Wow.
Yeah,
nice.
So I have to have my little girl tuning in on that. We'll be right back with more Lambda Weekly. We're going to talk a little bit about what it feels like when you're not even comfortable or respected in your own community.
This is Lewis from UT Arlington, and I listen to Lambda Weekly podcast at lambdaweekly.com.
And welcome back to Lambda Weekly. Again, here with Leslie McMurry and Katie Sprinkles, filling in for David and Taffet. David and Patti.
So yesterday, Katie and I were walking along near a Frisbee golf course in the beautiful town of Carrollton. It's one of those greenbelt areas, which is pretty nice. And there were some guys that were playing Frisbee golf, and one of them chucked his Frisbee into the stream there. And I said to Katie, he must not like that Frisbee. He just threw it in the water. And, of course, it was an errant throw. So anyway, it was on our side of this creek. And so I just went down to go get it for him. I reached in the water, and I tossed it back. And he goes, "Thank you, ma'am." And I said, "You're welcome." And off we went. And I was kind of commenting to Katie. I said, it's interesting to me. And I'm really curious, and maybe we can get your thoughts on it, because I really, rather than want to turn it into a monologue, I want to get, what your feelings are. But we live in Republicanville. We live up in Capel, and never have a problem. I mean, we go to restaurants, grocery stores, theaters, shops, riding our bikes, go to parks, whatever. We've got friends, our neighbors. We get along great with them. And I never, ever get misgendered there, or like in that park where we were yesterday, or anywhere else. We've driven to go see my kid all the time in Atlanta, so we drive across Louisiana, Alabama, Mississippi, Georgia, not necessarily in that order. Truck stops, places that are not very forgiving of transgender people, never have a problem. The only place where I get misgendered is in the neighborhood. And that, to me, is like mystifying. It's like you'd think the one place where you're safe is around your community, the LGBT community.
Right.
But the only place I've ever been called a tranny is down there. And that to me is, again, mystifying, because I wouldn't ever use an epithet against someone down there, because I understand just how much that hurts. And to me, misgendering hurts like a slap in the face.
Well, of course.
So I'm wondering, why because you were talking about not having a place in your own community. I was talking with someone the other day, another woman, and I said, it's funny because, I used to like to play golf, but I wouldn't feel comfortable in a men's locker room. Certainly, at a golf course or with men in like a men-only dining room. I'm not welcome there, nor do I want to be there, nor do they want me there. But there are certain groups with women who don't view me as fully female. And, well, you haven't paid the dues. You haven't suffered like we've suffered. You've had male privilege. Yes, I have. Had it for a while, gave it up. Didn't feel comfortable on me. But to say, well, you can't ever be fully welcome with us because of that is disappointing to me. It's hurtful. And to say, well, you should just hang with other trans people, well, that's okay, but in many cases, the only thing that we share in common is the fact that we're all transgender. They might not be people I'd want to hang with outside of that one commonality.
Right.
We might have different religions. We might have, I might have kids where they don't. I might have interests where they don't. So just the fact that we're transgender doesn't mean that we would gel as friends. So I just want to be welcome where, we have commonalities, but sometimes we don't feel really truly welcome anywhere. So I wonder, why is it this? It almost seems that this animus or lack of caring or laziness, or I don't know what it is, but why in the LG community would there be this treatment of trans people?
So I don't know the exact answer, and I wish actually my sister were here, because she's a therapist, so she might better be able to say this than I would. But in hearing you talk and everything, I'm reminded of. I don't think those of us that are part of, for lack of a better word, identity politics, I don't think we do enough in our adult lives dealing with the hurt that we went through maybe in younger years, or that we continue to go through now. So that for me, and I can only speak for myself, that for many years I didn't understand the trans community, and probably said and did things that I shouldn't have said about the trans community. But in my mind, for so many years I was made fun of and bullied and everything because as a gay man I was too feminine. That when I finally moved away from where I lived and then came to Dallas, I would go to the neighborhood and I didn't understand drag queens, who I understand are not trans. But I didn't, in my mind, it was all lumped together, drag queens, trans, etc. So that I didn't understand why these people were basically affirming what the bully said.
It's funny because, Katie and I were talking about that a little bit this morning, is that we see it from the opposite side, because you're saying, here's these trans women, that's not me, yet I get accused of being that. Like I've heard people say, well, isn't a trans woman just a really, really, really gay person? It's like, no, not really at all. It's nothing like that, because sexual orientation and gender identity are as different as car batteries and umbrellas.
And that really confuses a lot of people.
I ended up writing a very firm letter to a TV station in Tampa, because they were doing a story on Kristen Beck, who was that Navy SEAL who is transgender.
Right.
And they were talking about her in the context of, there's this Navy SEAL, and when they say Navy SEAL, they showed her as Chris Beck, as a guy, with a gun and all the Navy SEAL gear on. And every time they said, because I watched the story, it was showed up on the internet, so I'm watching it over and over on my phone because I couldn't believe what they were doing with it. But it was a subtle thing that the TV station did. Every time they said the word transgender, they flipped to a pride parade with these garish drag queens walking behind this float dancing to disco music. And I want to scream at the TV because that's not who someone who's transgender is. That's not us. And you're looking at someone who's transgender and saying, well, that's not us. So I think that there's maybe that rift a little bit. But to me, it's puzzling when one group who is oppressed oppresses another group who is oppressed. And I think that we need to cure that within our own community. First of all, because there's not enough of us. I mean, even if you lump L, G, B, and T and all the other alphabet, we make up, 7% of the population combined?
Combined, yeah.
So we don't really scare a lot of people. Transgender people by ourselves, 0.5% of the population, we don't really scare anybody. But so we really, really need to pull together and understand that while we may be different, we're all they're out to get all of us.
To answer, like Josh said, I don't have the answer. I don't know. But I will tell you that, obviously I'm black, but growing up as a black kid in a mostly
You're black?
Yeah.
Wow.
Shocking. You learn something new every day, don't you? Growing.
I want to see your ID.
Yeah.
I got to prove it, right? So, growing up in a mostly white neighborhood for mostly, in white schools for most of my life, you just kind of learn really quick that you don't want to be offended, so you don't want to offend other people. Mm-hmm. So that's always been, got very, very been cognizant of that, So
I don't mind being offended. I just don't want to be hurt.
Well, well, that too, and so. Whereas, we don't always get the right terms right or whatever, but if I know, once I learn that, hey, that's not nice, I wouldn't say or something like that. Specifically with the term tranny, and we could go on about that for a while, but I have trans friends to this day that use that term with each other.
With each other.
So I didn't know until, when it blew up about 4 or 5 years ago, that's a bad thing to say.
Well, I'll tell you the reason why, and for those listening, maybe you already know, but for those listening, the reason why transgender people are so sensitive to that particular word is it's often the last word we hear before our skulls are caved in.
Gotcha. Yeah. It's not meant to be a term of endearment.
No, it's not.
No.
So,
and another thing I know is that, especially minority communities, whether they be the LGBT community, the black community, Hispanic, whatever, we seem to be our own worst enemy. And that's true across the board.
Divide and conquer.
Yeah,
There's
exactly.
been an effort for that, too.
Exactly. So when you're in the neighborhood and somebody sees you and makes a statement like that, they're just being an idiot. I mean, there's no other way to put it. I mean, it's like, why would you say that? Interesting, you told me that, when you go into work, you're tense sometimes.
Yeah, sometimes.
And that's unfortunate.
I just know that I'm going to encounter, people that are either just because of laziness or a lack of education or what. And if it's a lack of education, it's something we can fix with advocacy and getting out and, persistently educating people to things that might be either hurtful or offensive to someone, or ways that you can deal with someone else or be sensitive to someone else. That all can be fixed with education. If it's animus, if it's resentment, that's a whole different ball of wax. So that's what I was kind of curious about, and I'm not trying to challenge you on the up and up, but it's like, what have you heard, or other people within the community? Is there a dislike of transgender people, or a resistance to using proper names and pronouns, or is it just an education issue? Because I
think it might be a little. I think it might be a little bit of both.
Well, and what was interesting is earlier today, Leslie was watching a clip on YouTube from John Oliver, and he was lambasting the media for how they treated transgender people. And there was a clip, of course, the infamous Katie Couric interview, and there was a Barbara Walters interview, and they're asking about people's junk.
Right.
And, of course, now, because of the hullabaloo about that, you don't see that much anymore.
You don't hear that anymore.
A few years ago, RuPaul, interestingly enough, had used the term tranny, and there was a huge blow up. And now more people know, ooh, wait a minute, we probably shouldn't use that. We shouldn't ask about your junk.
But I don't want to make people intimidated or scared to talk to us either. I don't want to get to that point where they're like, oh my God, that person's transgender, there's nothing I can say to them because they're going to get pissed off no matter what we say. That's not the case, and I don't mind educating people if somebody wants to ask. But yeah, I mean, it's like if I come across a new checker at the Kroger when I'm going through, the first question I have isn't going to be about her genitalia.
I agree, but I think as far as the several things, you're right. We could spend an hour on this topic.
Yeah, we could.
We talked about this before the show. On your genitalia question, I think something led up to that. And what I mean is, I remember as a kid in the 80s when there was this few and far between person that was on the show who had, and then it was, you weren't referred to as trans individuals, just as somebody with a sex change.
Yeah.
Right.
That's all they talked about was the surgery. It's like, okay, to become another gender, you had to have surgery. Sure. So I think we were conditioned to that. It's like, okay, that's,
the standards of care were even set by this imposition of, okay, the ultimate goal of transition is surgery.
Exactly. That's all they talked about. Yeah. And so I don't think everyone, when they were asking about people's junk, I don't think they were trying to be malicious. I think that's the way a lot of people have been conditioned. Now we know better. And even back then, the laws were to be legally another gender. You had to have the surgery. That's not the case anymore.
Well, the Barbara Walters question was only from like a couple of years ago. And she said, so if you were to be naked in front of me right now, would you look like a woman? And it's like, that's just a really inappropriate question.
No, I look like a tall person with a fruit bat between my legs.
And again, with the term, the tranny term, and RuPaul, defended it, and so did the contestants on his show, which most of them are drag queens, but there are a few trans individuals. They defended it. We use this term all the time with each other. What do you say to that?
I think that using it with each other in a room where there isn't TV cameras is one thing, but I think that there's at least some responsibility that you should have to understand that there might be kids watching. It's kind of like dropping whether it's a racial or social epithet. If you have kids that are listening, you're giving consent that that's an okay word to use. And they don't know context, and they don't know that it's okay to use from this person to this person, but it's not okay to address somebody that way.
And it would that argument that, well, we're all drag queens, and don't worry, I've got friends who are drag queens. I'm not slamming on drag queens.
No, it's beautiful art.
But in context of the RuPaul situation, I don't think any of the people who were defending it at that moment were transgender. Mm-hmm. They were all drag queens. And that's a little bit like saying that, you know what, in private, all of us white people use the N-word.
Right. So I was just about to go there.
So therefore, we should be able to use it. Yeah. We use it among ourselves all the time.
Right. Well, or using it on a TV show where kids could be listening and say, oh, suddenly that's okay to use again. And that's just not.
So, I think you're right. I think with the term, with the issue of epithets, period, it depends on context. And it depends on who's saying it and saying it to whom. Again, with the N-word, it's never been a part of my regular speech or lexicon ever. When I was a little kid, my brother and I, we got popped in the mouth if we said that. But as I grew up, I understand that's a common term that a lot of black people use with each other. But if a white person says it to them, you better get ready to fight. So I get
I think
that.
If you go to Alabama, there are a bunch of white folks down there that use it. So
I'm sure, absolutely. There's a lot of white folks who here say it.
You don't have to travel to Alabama.
I don't have to travel to Alabama to say that.
But if you do go to Alabama, make sure you go to Gadsden, Alabama, the Mars Shaved Ice. It's a great parking lot to throw up in. I'm just saying.
So with that term, I know that's just one of those things that if you are in the neighborhood, so to speak, you shouldn't have to hear it as an epithet.
Correct.
You shouldn't. You shouldn't have to. Now, you didn't say this, but have you all been in the neighborhood and someone referred to you as sir?
Yeah.
Yeah. Mm-hmm.
See, now that's unfortunate.
Yeah.
clearly, whatever you think, and I think why you probably don't have problems with this, and when you say, you live in a very Republican area, I think most people just want to be common and decent. Like, look, they're clearly presenting as women. I don't know what their story is. I don't need to know what their story is. They're clearly presenting as women. Thank you, ma'am, for picking up the frisbee for me.
And that's the typical response. I got served a couple times in the neighborhood, but it wasn't from any of the shops, any of the restaurants, all the employees that I've ever encountered in the neighborhood, whether it was at the clubs, whether it was at the restaurants or any of the shops, have all been extremely friendly and respectful. So I haven't seen any of those problems, but occasionally you'll run into somebody on the street. I had somebody asking me for directions. That was the context. We were there on the corner of Throckmorton and Cedar Springs, and they said, "Excuse me, sir," and I'm in a dress.
Get out of here.
And I was like,
"Are you talking to me?"
What? And then they asked for directions, and I was like, "I haven't gotten past the sir crap yet."
Right. Wow. Wow.
And then they were like, "Oh, well, how was I supposed to do that?" And so I said, "Well, how would you like if I walked up to you and said, 'Excuse me, jackass'?" Right. I said that a little more colorfully, though.
All right.
I cleaned it up here for you folks here at the radio station.
Well, you are right. We could talk about that for a whole hour, and please come back.
Yeah.
See, unfortunately, yes, but come back so we can talk about it some more. Thanks again, ladies. Thank you so much for coming to help out
No worries.
in the past couple of weeks. Yes, you can have next weekend off. Thanks, and we'll catch us next week here on Lambda Weekly.
This is William, hopefully your favorite videographer from Two Hats Publishing. I hope you enjoyed this video. If you like it, please leave comments below, or like, follow, or subscribe to us and get notices of all our videos. We love it, even when you call.